Hello everyone and welcome to a new episode in our program In Sync. Today's episode is really interesting, and especially in the hot weather, we see it more often in the clinic. But before I proceed and introduce our today's topic, I would like to welcome my colleague and my friend Dr. Mariam Aldashti. How are you, Mariam?
How are you, Sundus? How are you today?
I'm good, trying to adjust to the new change in temperature.
Yes, it's extremely hot.
It is.
And you mentioned today's topic, and actually today's topic is something that I see frequently, perhaps a couple times a week in my clinic, because it is relatively related to my specialty, which is lymphedema. And it's something that can be mistaken when it comes to the differential diagnosis or the diagnosis into other conditions. But at the end of the day, obviously there are tests to confirm this condition, which is cellulitis.
Exactly. And from the name, cellulitis, it means that, as we mentioned before, itis, it means inflammation. So it's inflammation in the skin layer of the body. So if there is any inflammation, and usually it is caused by bacterial infection, then there will be redness, pain, swelling, and most of the times it is associated with high-grade fever. And as you said, you see it a lot in your clinic, and I see it also a lot in my clinic because of the kids. Now in the hot summer, while they're playing on the beach, while they are in the gardens, outdoors, enjoying, traveling, all of these sometimes can lead to the formation of cellulitis, and usually this is due to insect bite.
Yes, it happens, absolutely. So insect bites, or sometimes just cuts. Some cuts and scrapes where bacteria can seep into the skin will cause cellulitis. Now, from my standpoint, usually when my patients have cellulitis, it's always recurrent cellulitis due to a suboptimal lymphatic system, because again, it's interconnected. So it can be different causes. It can be, like you said, bacterial due to a cut or a scrape, or post-surgery sometimes because of incisions, and this obviously the skin will be more prone to bacteria because the wound is open, so you're exposing our biggest organ, which is the skin. Or it can be from a suboptimal lymphatic system. So there are different causes, but at the end of the day, they are the same symptoms, and treating the way to treat it will be the same.
Exactly. And you know, because of that, one of my friends, actually, she came from abroad. Her name is Genia, and she is 45 years old, and she's actually Spanish. She came to visit us in Kuwait, and I invited her to a family chalet. And there I warned her that you need to keep your skin moist because there are a lot of insects and mosquitoes. You don't want to get bitten, and then it will cause infection. And the threat actually came in point because she didn't notice that. But suddenly, after coming to the chalet in a few days, she noticed that she had fever. And she thought, because it's summer, maybe it's the flu, I will just take antipyretics or Panadol and it will go away. But the fever persisted, and every 3 hours or 4 hours, it's becoming even higher. And then it reached to a level where it is 40. So she called me and she said, I have fever. And I told her, you just need to check your body if there are any insect bites, any swelling you noticed. And then she said nothing. So I asked her the usual questions. Do you have runny nose? Do you have vomiting, diarrhea? I just wanted to rule out other causes for the fever. And then she said no. And then after that, in 2 days, actually, she called me and she said, I think you're right, because now I cannot wear my usual shirt. On the right side, it seems like a little bit tight, and I cannot even raise my arm. So could you please come and check it? And I actually went to her room in the hotel, inspected her body, the arm, and then I noticed that at the back of her arm, there was an insect bite actually, and there was big swelling, redness, and when I tried to touch it, it was really painful. So I told her, you know what you have something that is called cellulitis. You need to take oral antibiotics, and you need just to observe, put warm compressors, and then we're just gonna follow up and see if the symptoms resolve or not. and unfortunately it did not. The swelling became even worse.
Yeah.
So I told her, no, this time you need to go to the hospital. The antibiotic route needs to be changed. Instead of oral, now it needs to be IV or intramuscular. So actually she went and they started her on intramuscular injections. After that, in 2 days or 3 days, her fever subsided. The swelling even became less, especially with the compressors. So that's why I thought we should discuss it, since it is the season and since we are seeing it. People think that only going to areas where insects are abundant there, then they are more prone. But in the upcoming segment, we will discuss the other case scenarios that might be also the cause of cellulitis. So not only insect bites, there are some other medical conditions related to skin or other organs in the body that may lead to this formation of cellulitis.
Yes, absolutely.
The thing about cellulitis is that people think we should see it. So either arms and leg, and yeah, sure, because this is the most common areas, but it can happen anywhere.
Absolutely.
Around the eyes, the lips, anywhere in the body.
Yes, absolutely. So any part of the body where obviously there's skin, and we have skin everywhere in the body, anything that can happen in the specific area will lead to cellulitis, which is inflammation of the skin area or the cells. So it's common actually amongst everyone. Or amongst the population, and it can happen in any age. So it's not restricted to a certain age group, but it can happen to any age. It's relatively common, and it can happen anywhere in the body.
Exactly. And as we mentioned, it's not only a disease that you can find it in adults, also kids can have it.
Yes.
So we just need to be careful, always inspect. There are red flags or red alarming signs that this might need medical attention, not only just warm compressors and follow up. Sometimes, as it happened with my friend, we need to go seek medical advice because extensive measures needs to be taken more to prevent a complication.
Absolutely.
People think that cellulitis is only inflammation in the skin and then that's it. I just take antibiotic, then it will go. But what they don't know, or they don't put in mind, that if you don't treat it, then other complications
will happen. Definitely.
Might happen. Exactly.
Yes, absolutely.
And I think we can go more into details after the Did You Know report. Stay tuned with us. Hello, everyone, and welcome to a very interesting topic. So we discussed before the break regarding the overview about cellulitis. How does it happen? And I think now we should go into more details about the causes that may lead to cellulitis. Like my friend Ginia, what happened with her is insect bites. So insect bites usually they will cause skin defect, and the bacteria will go from the mouth of the insects or the tip of the insects into the skin. And usually the causative organism are either streptococcus or staphylococcus.
Absolutely.
There are a little bit of strains that on the arising, which are called the MRSA or methicillin resistant staphylococcus aureus. These are the 3 most common bacteria that lead to the formation of cellulitis.
Yes, absolutely. Personally, I experienced a very traumatic episode. So I was traveling, and you know, in some hot climate weathers, you're going to wear sandals. Most of the time, you're not going to wear closed shoes. And we went to a park, you know, just sat down on the bench. And then afterwards, later on, I noticed some red spots. Initially, they were slightly itchy, didn't think much of it, tried to ignore it. I knew something had bitten me, but I wasn't sure exactly what. And then I woke up in the middle of the night. My legs were extremely swollen. It was very painful, and there was a localized cellulitis. And then I discovered later on that it was fire ants.
Oh.
So I was bitten by fire ants. They went to town on my legs.
Was it painful?
It was painful. I mean, I felt nothing at that time. I absolutely felt nothing. It was totally fine. But then afterwards, it was extremely painful. I couldn't wear any shoes or sandals. I mean, going to do school pickups, I was struggling because nothing would fit. It's extremely itchy, swollen, red. So obviously I had to take a course of medication, but it took a long time to be treated. So it's a relatively, obviously, uncomfortable thing. And you try to avoid it, but in reality sometimes you don't you know, really get to do the full precautions, because, you know, insects are sneaky and you don't
Exactly.
I felt
You don't see
nothing.
it coming.
And I felt nothing, absolutely nothing. So it was a very traumatic experience, which until this day, you know, obviously I remember. Now, the other reason, if we're going to talk about non-insect or no surgical cuts or any cuts in general. So I mentioned that I see a cellulitis often in my clinic, and that's due to a suboptimal lymphatic function, because the lymphatic system is the system where it gets rid of bioburden. And what is bioburden? Is basically, because we're human beings and the cells are active and working, so byproducts tend to accumulate. And if the lymphatic system is not able to get rid of this, then those byproducts tend to deposit in the interstitium area, which is the skin or cell area.
Yeah.
And what happens is then they start to form the localized cellulitis, which the limb will be red, swollen, painful. The patients tend to experience a fever at times. And obviously, just by knowing the condition pre-hand and examining with the combination of the symptoms, then we are immediately able to tell if it is cellulitis or not. And this usually requires IV antibiotics and admission at times, because it's a cycle that's recurrent. But obviously the way to break this cycle is to treat the underlying cause, as in any other condition.
Exactly. And you know, also, Mariam, one of the other causes for having cellulitis, we said that the bacteria will go into the skin whenever there is an abrasion or cut in the skin.
Absolutely.
One of the cases that leads to cellulitis is eczema.
Yes.
And that's why we insist on people and parents, moisturize,
yes.
Don't keep it dry, because
Yes.
if the skin becomes dry and cracks will happen,
Absolutely.
then the bacteria, Staphylococcus aureus, usually it's on our skin. And if there is no cut in the skin, then it will not cause any infection. But if the skin is dry, especially with eczema, and then there will be
the skin is
itching,
compromised.
exactly, then the bacteria that is not causing any harm will start causing harm.
Absolutely.
And that's why one of the causes for cellulitis is untreated eczema.
Yes.
And that's why we tell them, especially the ones that happen around the eyes, around the mouth, on the skin and flexures, all of these are the sites for eczema exacerbation. So if they are not treated well and the eczema is not controlled, then it will lead to cellulitis.
Absolutely. And some conditions actually who are sometimes immunosuppressed conditions, such as HIV or inflammatory bowel disease. So if you're immunocompromised, then again, your immune system cannot come to your defense. And a simple cut or an abrasion can cause cellulitis, because your immune system is not able to fight any bacteria. And it's actually interesting, because you sometimes see what we call lymphangitis. So the lymphatic channel, you can see it's like streaks of red, because the lymphatic channels become inflamed. So it's a very interesting phenomenon. Now, we obviously have to differentiate if it's different conditions, such as DVT, deep vein thrombosis, or the flesh-eating bacteria. This is the common name. Necrotizing fasciitis.
Yes.
Okay, so we have to usually differentiate, and there are ways to differentiate, because neck fash or the flesh-eating bacteria evolves really fast, and the way they do it is they have to monitor in the hospital, and they usually mark a line with a marker to see, is it spreading, and obviously this is life-threatening and warrants immediate surgical attention.
You know, Mariam, it's interesting, because the cellulitis, if it's not treated, then it will go from the layer of the skin to the layer underlying the skin, which will cause fasciitis itself. So that's why it's really difficult to differentiate between both. But the history and the mark of the skin abrasion actually gives us a clue regarding, is it a cellulitis that has complicated, or it's a necrotizing fasciitis.
Yes.
One of the causes also non-insect related, which is diabetes mellitus. Diabetes, especially if it's not controlled, they will lose the sensation of the extremities. We mentioned in the previous episode. So if you step on like needles, or small wooden parts, anything that cuts the skin, diabetic people will not feel it, and then they will come with the disease of cellulitis, and then they will know that they already had a cut. This is one direct cause of diabetes. The other cause of cellulitis through diabetic people is through gangrenous foot. Gangrenous foot also because it's a bacteria. So if you do not treat it, the bacteria will go through the cracked skin and will cause also cellulitis. So it has two ways of acquiring the disease if you are diabetic.
Yes, absolutely. And actually, I had a patient, she went into cardiac arrest because of the cellulitis, because she ignored it, it wasn't treated, and obviously she had multiple other comorbidities, so her body couldn't handle. And due to the cellulitis and obviously the other conditions, she went into cardiac arrest. So although it's something superficial, let's say to begin with, it can be managed easily, but if neglected, obviously it can be life-threatening.
Definitely. And I think now it's worth mentioning, if not treated, what will happen? You mentioned it will cause organ failure. So kidney failure, heart failure, liver failure, pancreatic failure, lymphatic system failure. All of these can be a cause of complicated cellulitis or untreated cellulitis. If the cellulitis is not treated well, what will happen? It's a bacteria that went into the skin. If it will go deeper into the bloodstream, then it will cause septicemia, which is a bacterial infection in the bloodstream. And this is very dangerous. And this is the cause actually for the multi-organ failure, because the infected blood will go everywhere in the body.
Because the blood is supplying the organs.
Exactly, where it will cause the multi-organ failure. So it's not something simple, as you said, it's only inflammation and pain, and then you take antibiotic and then that's it. No, it needs to be monitored, and we need to make sure that the antibiotics are really working.
Absolutely. And obviously you can tend to see it, like you said, in kids, and usually kids, because they ride their bikes, they are outside a lot. So, you know, just this simple cut where it becomes inflamed around it, again, this is possible and very common. But you know, kids are resilient at times because they are relatively healthy, so usually treating them just takes a couple days or 3, just with the proper, obviously, management. But we tend to be afraid when it comes to older generation who have other conditions, because like we said, their immune system is not optimized, and they usually tend to have other comorbidities as well.
Exactly. And the mode of examination, usually history taking, as always.
This is the most important in any condition.
Exactly. When did the fever happen? How did it happen? And all of these. But I think we should take a small break and come back to discuss it.
Let's go ahead.
Stay tuned with us. Welcome to the last part of our episodes today, how to diagnose and manage cases of cellulitis. So before the break, I just give a brief introduction. Usually we get the information about what we are dealing with through history. 85% of the diagnosis will be made through history and physical examination. So when did the fever started? When did the swelling started? What were you doing at that time? Anyone infected or not? There is any associated symptoms, the fever, how often it is rising? Does it take a few hours, like 6 or 7 hours, or every 3 or 4 hours, whenever the antipyretic effect will start to wane off? These are usually the symptoms of cellulitis. And then we go for examination. We said we look for the
cause or the
contamination point. Where did it happen? Is it an insect bite? Is it a skin abrasion? Is it, as we said, a diabetic patient who had a skin abrasion unknowingly, or cut in the limb itself? And as you said, does it involve the lymphatic system or not? So examination and physical history and medical history will give us an idea about what we are dealing with.
Yes, absolutely. And I remember the patient, and she had just undergone plastic surgery. So it was an abdominoplasty and I think a brachioplasty. So she presented to me 3 weeks post-surgery, and this is usually not common. When 3 weeks post-surgery, she came on a wheelchair, because after 3 weeks, usually an individual is able to move and be comfortable. And she mentioned that she had a fever the night before. And obviously for me, this is second red flag. First one is you're not walking, you're on a wheelchair. Second one is that you had a fever. And then when I came to examine, she had a tender inguinal lymph node. And the lymphatic system is our defense mechanism. So it was very tender on the, right side. The right side was a tender inguinal lymph node. And then examining, she had a large collection. It was red, it was tight, the skin was extremely painful and tender to touch. So immediately I knew there was an underlying infection and she needed to be started on antibiotics, because there was a localized cellulitis or infection and it needed to be obviously taken care of. She started immediately on antibiotics, and then a day or two later she was completely better when it came to at least the symptoms. Obviously the edema will stay and it will take its course to resolve, but she didn't understand that she had an infection. She was just taking some medication to reduce her fever. So sometimes you think you can manage it at home, but at the same time it's always better to seek medical advice to combine examination with history.
Exactly. And you know, Mariam, usually the mode of management is that we give them oral antibiotic if it was a simple cellulitis that you can see contaminated or confined into a certain area. It's not spreading to a vital organs. So you can give second or third generation cephalosporins, and you just observe, as we did with my friend, for 1 or 2 days and see that symptoms improve or not. And we also put a line just to make sure that it is not spreading. And if it's not responsive, then we usually start, as we said, in intramuscular or intravenous antibiotic, and usually where we use vancomycin and third generation cephalosporins. Sometimes we need to use steroids, and this just to help to also control the inflammation and reduce the swelling, reduce the pain, reduce the symptoms, along with antipyretic to reduce the fever and the pain, until the antibiotic will start showing its effect. And usually the antibiotic will show the effect between 36 to 48 hours until we see an actual effect.
Yes.
So that's why we need to give these medications along with warm compressors, just to make sure that it is not spreading. There are also alternative things or helping modes of management, which is the stockings.
Compression stocking.
Exactly. These will help, especially if it was around the arms, around the legs. We use them just to reduce the swelling and contain the always I think about contamination.
Yes.
So containing the inflammation in one place in order to prevent it from spreading.
Yes, absolutely. And this is something I always explain to my patients, because people who have lymphedema tend to go through this cycle frequently. So they experience cellulitis, IV antibiotics, resolves, and then 2 months later again, because you're not treating the underlying cause. So treating the underlying cause of it, we're going to specifically talk about lymphedema. Obviously, that takes its own route. And then at the end, we might recommend compression stockings just to contain the area and prevent further accumulation of lymphatic fluid. Sometimes it depends obviously on the situation, elevation of the limb. This will help in certain situations because you're taking off the load from this part, whether it be the arm or the leg. I mean, you prop it up, either the arm or the leg, because you're eliminating gravity.
Yeah.
So this also will help when it comes to the collection of the edema, alongside any other medications needed.
Exactly. And Mariam, we should mention that also vital organs, if the cellulitis are involved there, especially around the eyes, we don't take it lightly. We don't give oral antibiotics. And this immediately we give IV antibiotics along with steroids, just to preserve the organs, because if the eye is gone, then definitely there's nothing to replace it. So there are some certain areas or certain organs, when we know that there is cellulitis involved, then it's better to give the IV antibiotic instead of IM or oral.
Yes, absolutely. And then, well, let's talk about prevention. Now again, in my case, I couldn't prevent it because, first of all, I wasn't aware. I didn't feel anything, but at least at times you can prevent it by, when it comes to eczema, like you mentioned very well, keep the area moisturized, hydrated. If you're going hiking or somewhere in the woods where there's mosquito, try to wear long sleeves as well. So you can try to prevent it, but it's not 100% preventable.
Exactly. And Mariam, you know, my friend, she Googled and she was searching for answers because she was really desperate and how it's fast exacerbated. Then she said, I read about something that I need to take prophylactic antibiotic. does it apply to me? And I told her no. Since this is your first time and it has result, then it does not apply. We use prophylactic antibiotic, especially in the cases, as you mentioned, the recurrent cellulitis. In those, then every 3 weeks, there will be a 5 short course of antibiotic, and then we will stop and see. If it's recurring 2 or 3 times, then definitely, and we know that the lymphatic system is involved and is the causative thing behind the cellulitis, then definitely we need to give prophylactic antibiotic.
Yes, absolutely. But then again, not everyone needs it, like you just said. If you treat the underlying cause, then it's not necessarily that you will, because you know everyone is afraid of the idea that needing constant medication. And we always say again that we tend to build the body, because it's smart, it tends to start building any resistance organisms to certain medications. So although prophylactic antibiotics are sometimes necessary, but they're very minimal as to which population is given to.
Exactly. And you know, Mariam, you mentioned a valid point. One of the investigations that might be required, and as you said, not in all cases, especially if we suspect that the symptoms are not improving within 2 days or 3 days, if the fever is persisting, if the deterioration is happening very fast, then we need to do blood culture just to make sure that the bacteria did not go into the bloodstream. Also, we can take a sample from the skin, from the site of the fluid collection, just to know the organism that is there and to know, is it resistant to the available or the antibiotic that we're giving, or it's not. As we said, methicillin resistant Staphylococcus aureus is one of the 3 organs or organisms that's causing cellulitis. So we just need to make sure that it is not the cause, and then because this bacteria especially requires a special antibiotics to it.
And sometimes we need to do an ultrasound for the certain area, because it can be, like we said, DVT, which is deep vein thrombosis, and this needs a separate way of management. So this needs medication to reduce the viscosity of the blood, like blood thinners as we call them. Sometimes they might need to remove the actual clot. So different management routes. So we cannot always assume it's cellulitis, because sometimes they represent in a similar manner.
Exactly. And my advice to all our viewers, that if they suspect cellulitis or they see inflammation, fever, pain, tenderness, inability to move, I think it's better to seek medical advice and not postpone, because the problem with cellulitis, as we said, it spreads to adjacent organism. So instead of having a simple cellulitis, you might end up with osteomyelitis, which is inflammation of the bone, which is more dangerous. It might involve the heart, lungs, kidneys, liver, you don't know. So it's better, if you suspect a case of cellulitis, just to seek medical advice and get the treatment as soon as possible. I hope you benefit from our tips and points we gave you in our today's episode, but unfortunately we reached the end of our episode. Hope to see you again in a new episode in our program In Sync. You have a good day.
Stay safe.